This tutorial is intended to assist you as you interpret your dried urine test for comprehensive hormones when a female patient is taking progesterone, and this is intended to address vaginal application. If the anal mucosa is used, this would be mostly appropriate as well. So if you just look at a different combination of results, just as a reminder, between the stars here is the type of numbers you get. That's the reference range for premenopausal, whereas the purple band is postmenopausal. So you would expect to see these results here in the upper left-hand corner if there really isn't an increase at all above baseline. Those are expected numbers for a postmenopausal woman not taking progesterone. So if she's on, for example, vaginal progesterone, then you might be getting some progesterone in terms of the levels within the vaginal area. There is a uterine first pass, which will move the progesterone directly into the uterus, even if you're not getting a lot of systemic circulation of progesterone. But this should reflect systemic circulation of progesterone, and those results would represent a lack of that, really. Whereas, and in a person not taking progesterone, those would be the types of levels that would represent low levels when you're not ovulating. Now, on the upper right-hand corner, you can see where those progesterone metabolites have gotten just into the premenopausal range. So one of the metabolites is in the premenopausal range, one of them is just lower, but when you look at the overall progesterone, again, it's sort of low normal. So in a premenopausal woman, that would be you're likely ovulating, but you're not making a whole lot of progesterone. So if you're supplementing vaginally and getting a person into these sorts of levels, then it does likely represent a significant increase over baseline. Whether or not it's enough to balance the estrogen depends on the rest of the picture of what you're doing with the estrogens. Are you supplementing with estrogen and that sort of a thing? And again, there'll be a higher level of progesterone in the tissue surrounding the application site, so in some cases that's significant as well. But systemic progesterone in this case is somewhat equivalent to a woman who's ovulating and making a low normal amount of progesterone, whereas if you get the woman up into these higher levels of estrogen, like on the lower left, this would be for a premenopausal woman high normal. So those would represent, pretty hefty levels of progesterone. If you're pushing a woman up to those levels with vaginal progesterone, then you're getting a lot of systemic progesterone. And if you get the levels here on the lower right, then you're just up in the sort of high region. Is that problematic? It depends on the scenario. It depends on the estrogen picture as well. But that's where you start in terms of the interpretation. If you use the anal mucosa in terms of the application site, you may be more likely to get these elevated levels of progesterone, and that may not necessarily mean you have too much progesterone because the vaginal area does not empty into the liver. The anal mucosa does. It is different. The anal mucosa has more of a direct line to the liver, which means you're getting sort of pseudo first pass, and when you get first pass with progesterone, you tend to get a lot of metabolites. So you have to interpret this in light of how you're taking the hormone, and again, what also your status is with respect to estrogen. And this conversation is not really appropriate for other supplementation scenarios. It's not appropriate with topical, oral, sublingual. Those would be different conversations, and you'll want to watch the videos that are more appropriate to those. And we hope this is helpful as you interpret these results for your particular patient.